So this week we are going to skip right over chapter 17 and 18, which we will talk about next week. And we're going to talk about chapter 19, which is the support systems for the central nervous system, basically the blood supply and the cerebrospinal fluid systems. So basically the two fluid systems that support neurons and glial cells of the nervous system are the cerebrospinal fluid or CSF system and the vascular system. So the CSF system includes the ventricles, the meninges, and the fluid itself, the cerebrospinal fluid. The vascular system includes the arterial supply, the venous supply and the venous sinuses, and the mechanisms to regulate blood flow. So in the chapter there is a lot of anatomical detail, some of which we'll talk about and some of which we won't. So I'll talk to you about what I want you to know for the basics. In the module, there's sort of one brief page on blood supply, CSF systems, and disorders, and then a page on stroke and a couple other disorders. So it should be a pretty straightforward chapter, I hope, and maybe tie some things together. And then we will continue on to the cerebrum in chapter 17 and 18 next week, and we'll talk more specifically about areas of the brain and what they do and what happens when they are affected by a stroke or other brain injury. So the cerebrospinal fluid, or CSF, provides water and certain amino acids to the extracellular fluid. It supplies specific ions to the extracellular fluid, and it provides buoyancy to the brain. So the brain and spinal cord are surrounded all by the subarachnoid space, and we'll go through the meninges again, and the ventricles in the middle of the brain by that CSF to give it a nice cushioning effect. So we're taking our brain out every day into the cold, cruel world, and it's nice to give it a little bit of cushioning and protection. So the ventricles, they are the areas where the fluid is formed, and they form those fluid-filled spaces inside the brain. It's a system of 4 ventricles. So the lateral ventricles are, in this picture, that C shape. The C-shaped ones are the lateral ventricles, and they are inside each cerebral hemisphere, 2 of them, 1 on each side. The spaces extend into each lobe of the hemispheres. So below the lateral ventricle is the thalamus, and above is the corpus callosum, which is the bridge between the 2 cerebral hemispheres. The lateral ventricles connect to each other, and they then into a 3rd ventricle by the interventricular foramina. Then the 3rd ventricle is a narrow slit in the midline of the diencephalon, and the 4th ventricle is a space posterior to the pons and medulla and anterior to the cerebellum. The 3rd and 4th ventricles are connected by the cerebral aqueduct. So if any of those passageways are blocked for any reason, swelling or injury, it can cause a disruption in the flow of the cerebrospinal fluid. So the meninges are 3 layers that cover the brain and spinal cord. And we talked about this in the spinal cord chapter. The dura mater surrounds the brain and consists of an outer layer firmly bound to the inside of the skull and an inner layer attached to the arachnoid. The arachnoid is a delicate membrane loosely attached to the dura mater, and it allows CSF to flow into the venous sinuses. And we'll talk about the direction of flow in a minute. The pia mater is the innermost layer, and it's tightly opposed to the surfaces of the brain and spinal cord. So the subarachnoid space is between the pia and the arachnoid, and that is filled with cerebrospinal fluid. That's our cushioning for the brain. So this is the diagram from the book, and you can see the layering on the top is the skull, then the dura mater, then the arachnoid, the subarachnoid space where the fluid is, and the pia mater right on the surface of the cerebral hemispheres. So the CSF flow is unidirectional. It only goes one way. It's formed by blood, from the blood, by filtration, active transport, and facilitated transport within the ventricles. And we'll talk about a little bit more about that in a minute. It flows from the lateral ventricles into the third ventricle via the interventricular foramina. Then it flows from the third ventricle to the fourth ventricle via the cerebral aqueduct. And it exits the fourth ventricle through the lateral and medial foramina, entering into the subarachnoid space. And within the subarachnoid space, it flows around the spinal cord and brain, providing that nutrition and metabolic service. Finally, the CSF is absorbed through the arachnoid villi back into the venous sinuses. So that's where it returns to the venous system. So it comes from the arterial system. It's filtered, and some things are brought in by active and facilitated transport. It flows through the ventricles into the subarachnoid space, where it's absorbed back into the venous system. So it's that one-way flow, unidirectional one-way flow. Okay, so basically we talked about the steps of this, but the CSF is formed in the ventricles, circulates through the ventricles and into the subarachnoid space before being reabsorbed into the venous circulation. Supplies water and certain amino acids and specific ions to the extracellular fluid, and probably, meaning we don't know for sure, but it probably removes metabolites from the brain. So those byproducts of cellular metabolism have to get removed, and it's likely that the cerebral spinal fluid does that. So the meninges, we went through the layers. They're listed here again for you. It'd be nice if you knew the order of them, which one's on the outside, which one's on the inside. Here's the picture again. That's also in the module in the book. So some of the CSF is formed by extracellular fluid leaking into the ventricles, but most of it is secreted by choroid plexuses in the ventricles, or choroid plexes. And what those are is they're capillary beds that are, or it's a network of capillaries embedded in the connective tissue of the brain and the epithelial cells. So those choroid plexuses do the filtration and active transport and facilitated transport to form the CSF. So the CSF is a fluid that's similar to our blood plasma. The main difference is its chemical makeup. So when they do a spinal tap, they are usually testing for antibodies. They're testing for the makeup of the CSF, basically. Like, is there enough of the ions that you need in there? Are there extra things in there that you don't need? And by doing that, that can be used as a diagnostic tool for different diseases. In MS, for example, in the cerebrospinal fluid, they're looking for certain antibodies that are a response to the inflammation that's going on in the nervous system. So this is that same diagram of the unidirectional flow from the module and the book, figure 19.3. This is the same diagram of the ventricles that was in the module and the book. So with cerebrospinal fluid, common disorders are epidural and subdural hematomas, and we'll talk about the symptoms of those. Usually those are a consequence of trauma. Hydrocephalus, it can be congenital, where someone is born with it, or that can also be caused by trauma. Common causes of cerebrospinal fluid disorders are failure of the fourth ventricle foramen to open, so there's blockage, and there's blockage of the cerebral aqueduct. There is a type of cyst in the cerebrospinal fluid system called Dandy Walker cysts. I imagine they were named after two people. and an Arnold-Chiari malformation that we talked about in Chapter 5, where the bottom part of the brainstem protrudes through the foramen magnum, and it causes compression. And so that compression can close off the circulation of the CSF. Meningitis, it's inflammation of the meninges. That can close off circulation of the CSF. Or inflammation caused by bacterial or viral infections. So talking about the different CSF disorders, I would like you to know what's in this chart. So for this module, I made a lot of charts because it's nice to have that in a nutshell, basically. So very, very briefly, the disorder, the pathology, and the signs and symptoms. So for epidural hematoma, epidural, it means it's around the dura. It's usually caused by arterial bleeding between the skull and the dura, most often resulting from a torn middle meningeal artery caused by the fracture of the temporal or parietal bone. So trauma is usually the cause of an epidural hematoma. The signs and symptoms are worsening headache. So you start with a headache and it just gets worse. Vomiting, decreasing consciousness, hemiparesis, and Babinski's sign. Epidural hematoma has a quick onset of those signs and symptoms. Subdural hematoma, on the other hand, it's caused by venous bleeding, and the underneath the dura. The symptoms are similar to epidural hematoma in terms of worsening headache, vomiting, decreasing consciousness, hemiparesis, etc. But instead of a quick onset, there is a gradual onset. So it gradually worsens over days or months. So a lot of times if someone has a subdural hematoma, they don't realize it until later. So they had some sort of traumatic event, skied into a tree, the blood's building up underneath their dura mater, and a lot of times people die from it because they don't seek treatment very soon. Hydrocephalus, it's caused by the CSF circulation being blocked in some manner, and pressure builds up in the ventricles. So it could be congenital, it could be caused by trauma. In newborns, it's characterized by a large head, that's from the excess fluid, poor feeding, inactivity, and a downward gaze. In adults, there are usually other symptoms such as headaches, confusion, motor issues, and usually hydrocephalus is treated by implanting a shunt that bypasses the normal CSF circulation to get that excess fluid out of the area. Meningitis is inflammation of the membranes surrounding the brain and spinal cord, so inflammation of the meninges. It's characterized by headache, fever, confusion, and vomiting. You may recognize that those symptoms are similar to a lot of the other things that we study in pathology, including the flu. One of the differences sometimes where they are thinking it might be meningitis, a lot of times you'll have some neck pain going with that, or neck stiffness. Because of the inflammation of the meninges, it causes that neck stiffness. So sometimes that's a characterizing, a differential diagnosis symptom. So meningitis can be caused by a bacterial infection or a viral infection. And there are vaccines for bacterial meningitis, and so that's nice. If you're, they recommend that certain people get those, like college students, for some reason, are more susceptible. And it's nice when there's a vaccine for something that really kind of has horrible consequences. So preventing it is a good thing. Okay, so in the next section we're going to talk about the vascular circulation of the brain and disorders thereof.